Good morning, everyone.
Good morning.
Thank you all for coming. What a great turnout we have here in the main Capitol Rotunda. And I want to thank everyone who's here today, and thank you for answering the call to support our ambulance services across the Commonwealth. We're joined here today by EMS personnel, hospital officials, and legislators from all across Pennsylvania. The reason we've come together today is that our EMS system really is in a state of crisis. No matter where you're from, urban, suburban, rural communities, your emergency services system is at risk, and that means lives are at risk as well. From childhood, we're taught that we call 911 in the event of an emergency. We assume someone will be there to help no matter what. But as ambulance companies and emergency services of all types struggle with a lack of human and financial resources, we can no longer take it for granted. The people of Pennsylvania are depending on us. If they have a medical emergency, quick response by a local ambulance service can mean the difference between life and death. In the rural area that I represent, most people live far from a hospital. We can't afford to lose the life-saving emergency services provided by our ambulance companies. But the threat of that happening is very real. As many of you know, the SR6 Commission is working hard to identify solutions to the many challenges facing our emergency response organizations. And like many of you, I'm looking forward to implementing those ideas. But right now, I think there are two concepts already supported by the Commission that we can all agree are ready for implementation today. One of those is House Bill 699, of which I'm the prime sponsor. The bill would increase the Medicaid reimbursement rates for a basic life support ambulance trip from $120 to $180, for an advanced life support trip from $200 to not less than $300. The current rates have not been increased since 2004, and they are more than 200% below Medicare and commercial insurance reimbursements. Most importantly, they come nowhere near covering the actual cost. The other issue is to provide reimbursement to ambulance companies for treatment that they provide to a patient, even if transport doesn't take place. Chairman Barrar and Chairman White both have issues to address this issue, and I know Chairman Barrar will talk about those efforts in a few minutes. But first, I'd like to invite Dean Bollendorf, the president of the Ambulance Association of Pennsylvania, to the podium. Welcome.
Good morning, everyone. Welcome to the People's House. I first would like to thank all of the EMS providers who traveled here today, members of the Ambulance Association of Pennsylvania, for coming here in support of these two very important pieces of legislation. I really want to thank the wonderful lawmakers who are stepping up on our behalf, in particular Representative Kauser, Senator White, Representative Barrar, and Representative Sonato. So I'd like to really thank those gentlemen for their untiring efforts to try and advance and support EMS in several ways. We have really experienced a great deal of challenges in EMS and reimbursement for many years now. Medicaid is probably one of the biggest challenges because of its significant growth. The Affordable Care Act moved the needle on the enrollees in Medicaid to about 700,000. And that's a significant number of patients that EMS now encounters. So when you're being paid at less than what it costs to provide the service, those numbers matter. And when there's more enrollees, it means there's more losses that are being incurred by EMS agencies around the Commonwealth. I've had the privilege, though, in my career to witness 2 Medicaid increases. The only problem is it took 40 years, and that's a very long time. And I think the basic problem is we don't have a mechanism to review our fee schedule here in the Capitol. When we approach the Medicaid officials, we are told, unless there's an access to care problem, we really won't look at your fee schedule. Well, we're developing an access to care problem as ambulance services evaporate and fail all over the Commonwealth. We're probably down 400 ambulance services in the last 5 years and approximately 10,000 service providers. So this is a real crisis for us, as Representative Cowser had stated. But once again, I want to thank everyone for coming today. This is a really important issue for us. And I want to thank again Representative Cowser for his effort. Thank you.
Thank you, Dean. We have with us here today Representative Steve Barrar. He's the chairman of the House, the majority chairman of the House Veterans Affairs and Emergency Preparedness. He's from the 160th Legislative District in Chester and Delaware counties, and he's the prime sponsor of House Bill 1013. Welcome, Chairman Barrar.
Thank you. Thank you. The people of Pennsylvania are depending on us to find a solution to this problem, and so are the people, the hardworking emergency preparedness people behind us who run our ambulance companies around the state. Thank you, Representative Cowser. I applaud you on drafting this important legislation that would provide necessary and fair support for the Commonwealth ambulance companies. I have also drafted a bill that would help ambulance companies financially. It would require ambulance companies to be reimbursed when they provide medical treatment, even if the patient is not transported to a hospital, which is Pennsylvania law today. When someone is in diabetic shock or is overdosing, emergency responders provide valuable medical care on site. It often eliminates the need to a trip to the emergency room, which undeniably is a benefit for the patient. However, it results in the ambulance company going without any reimbursement. Let's be honest, let's remember that emergency room visits are the most expensive cost of health care. So this would eliminate that need to take a patient to the emergency room, thus saving the insurance companies, the health insurance companies, quite a bit of money. And we're hoping that now that we've tried to educate them to this, that they would embrace this legislation. If an ambulance companies continue to provide care without being paid, we will all face the consequences. That could mean ambulance companies consolidating or going out of business and would have to cover a greater geographical area, pushing and resulting in longer wait and response times. It also means that taxpayers will face a far greater responsibility. We must do everything we can to support our first responders. For the past 3 legislative sessions, or 6 to 7 years, I have drafted a bill, and it has received unanimous support in the House of Representatives. Unfortunately, we're still waiting for the Senate to address this important legislation. For the sake of each Pennsylvania, it is our hope that they will do so soon. The crisis with our ambulance companies and the EMS community is real, and we need to start taking it that way. Thank you very much.
Thank you, Chairman Barrar, for your leadership on all of these issues, really. We have EMS personnel here with us today from urban areas, rural areas, and suburban areas, and we've asked some of them to speak today. So our next speaker is from a rural area. His name is Bob Marnotti. He's the manager of the Ridgeway Ambulance Service in Elk County. Welcome, Bob.
Thanks, Marty. This is a good day for us.
All right.
Let's hear it. This is a good day for us. Hello, my name is Bob Marnotti. I'm a manager of a very small ambulance service in Elk County. And I'm glad that through the task force and through these legislators, we're able to get reimbursed so that the smaller communities that we service do not go out of business, and we're able to provide 911 service. The 911 service question that was always asked at all the task force meeting, what would happen if you call 911 and nobody shows up? And that's what we're facing in a rural area. I'm also glad that this is June 6th. And it's nice and warm out. The task force met in January, went to Port Allegheny, and ended up going through snow and that to hammer out these issues. This just didn't happen overnight, and I would like to take the time to thank everybody, EMS workers, legislators, providers, and anybody that can help keep our ambulance service afloat. Thank you very much.
All right.
Thank you, Bob, and thank you for the life-saving service that you provide in Elk County, Pennsylvania. Senator Don White had planned to be here with us today. He has a companion bill in the Senate. It's Senate Bill 1003 to also deal with the treat no transport issue, but had a scheduling conflict and is not here with us today. So at this point, we will have Representative Chris Sonato, the Democratic chairman of the House Veterans Affairs and Emergency Preparedness Committee. He represents the 9th Legislative District in Lawrence County, and he's been a leader in the effort for both of these pieces of legislation. So welcome, Chris.
Thank you, Representative Kaiser, and it is an honor to stand here with my fellow committee chairman, Representative Steve Barrar, and to support Representative Kaiser as we highlight the dire need for this legislation. Emergency medical services are a critical component of Pennsylvania's healthcare system and to the overall well-being of our residents. As we all know, first responders provide life-saving care, often running to danger instead of away from it. Unfortunately, Pennsylvania EMS community, like many across the nation, face numerous challenges, including loss of volunteers and increasing costs of apparatus and training. As someone recently noted in the SR6 Commission meeting, EMS is slowly dying on the vine. Many do not realize that EMS costs include the direct costs of each emergency response, as well as the readiness costs associated with maintaining the ability to respond quickly, 24 hours, 7 days a week, costs that are not adequately reimbursed by Medicare. In the insistence of paying only when the patient is transported, Medicare limits the flexibility of EMS in providing the most appropriate care for each patient. In fact, EMS has only received 2 increases in medical reimbursement in 40 years, while expenses have more than doubled in the last 14 years alone. This is why, as legislators, we need to do more and to preserve and strengthen our EMS and ensure that our emergency responders are equipped with the necessary tools to do their job. We must be resolute in our efforts to provide support, including those initiatives we are here to discuss today. We cannot afford to do otherwise. Thank you for inviting me today.
Thank you, Chairman Sonato, for your leadership and all that you've done to support our EMS professionals. Our next speaker is Mr. Bill Haggerty, the President and Executive Director of Emergy Care Incorporated from Erie.
Thank you for the opportunity to speak today. I'm the Executive Director for 2 nonprofit EMS organizations in northwestern Pennsylvania. Emergy Care serves urban, suburban, and rural communities, and Corey Ambulance Service serves primarily suburban and urban areas, rural areas. These 2 organizations together employ about 270 clinical staff, which of course are mostly the EMTs, paramedics, and PHRNs. These clinical staff respond to calls in parts of 7 counties in northwestern Pennsylvania. All of our EMS systems have commonality. One of those is that we are ready to provide service 24/7, 365. We're prepared to respond quickly to serious accidents and critical emergencies. The communities we serve rely on our ability to be there when they need us the most. But that doesn't come without a cost. There is a cost associated with having staff, equipment, and medical resources available and ready to respond at a moment's notice. House Bill 699 and Senate Bill 1003 would make a big difference to our organizations and the quality and quantity of service that we could provide to the communities that we serve. Specifically, House Bill 699, as you've heard, Medicaid rates have not increased since 2004, and they're currently more than 200% below Medicare and commercial insurance reimbursements. Emergent Care and Corey Ambulance Service, like many other EMS organizations, have struggled to maintain that high standard of care for patients because of the constantly increasing cost to provide that care. Those costs include updating and maintaining equipment, purchasing medications, recruiting and retaining qualified EMS staff. Last year alone, and this is a very important number I want to give you all, Emergent Care had to write off over $1.2 million in unpaid or uncovered costs resulting from treating and transporting over 8,000 Medicaid patients. This does not include patients that we transport by wheelchairs transportation. As you heard Representative Cowser say earlier, Medicaid reimbursements are $120 for basic life support. It costs Emergent Care about $400 to do that transport. Medicaid reimburses $200 for advanced life support when the actual cost of treat and transport is about $600 for our organization. Last year, we responded to over 5,000 Medicaid basic life support calls, over 2,400 Medicaid advanced life support calls, and over 600 Medicaid paramedic intercept calls. So based on these volumes, the proposed increased rate would infuse about $600,000 into our organizations. So what would I do with $600,000? Well, I could buy 4 ambulances unequipped, bare naked. I could probably buy nice brand new 17 cardiac monitors. Ultimately, what I would like to do is I'd like to give my staff a $2 an hour raise, because these people are working for less than what you can make at fast food companies. With Senate Bill 1003, when we get the call, we must go, but currently most private insurance and Medicaid do not allow for EMS agencies to bill for the service they've provided. When we respond to a call and treat a patient, they refuse to be transported for further examination. EMS services do not get paid for their time, fuel, equipment, or services. We respond to over 1,300 calls a year that result in treatment but no transport to a medical facility. And again, that would be an added revenue cost of about $200,000. Thank you, Representative Cowser, and to all my brothers and sisters in EMS. Thank you.
Thank you, Bill, and thank you for the life-saving service that you provide all across northwestern Pennsylvania. We also have with us here another representative from rural Pennsylvania, Mr. Bob Sorg, the General Manager of St. Mary's Ambulance Service in Elk County, Pennsylvania. Welcome, Bob. Or Bert, I'm sorry, Bert.
Whatever, that's fine. Thank you. First off, I want to thank Representative Cowser for his unwavering support of EMS in the Commonwealth. Without him, we would be in a much worse place, and I want to thank you again, Marty. Our ambulance service provides EMS in a very rural part of Pennsylvania. In fact, we provide paramedic service mutual aid to part of Representative Cowser's district. Providing EMS in a rural area is difficult at best. Time and distance factors often make call turnaround times of up to 2.5 to 3 hours for one call. This is coupled with the fact that rural providers lack the call volume to make up for our losses. These facts equate that costs per call are higher in rural areas. I know our urban and suburban partners face many of the same problems, but it's compounded in a rural area. In addition, our hospital has become a critical access hospital, which means they transfer everything out. They're limited to 25 beds, and they tax us even more on getting people to where they need to go. Our large amount of patients go from 32 miles to 120 miles on an inter-facility transport. And again, it's a burden. And if somebody's on medical assistance, it's a loss. The gross revenue, not the net revenue per hour, is less than what a plumber would charge. If we look at net revenue, then we're simply in the negative. How many in Harrisburg would open up a business to lose money? Nobody. Simply put, medical assistant calls are a financial disaster for EMS. We lose money on every call. Where does our lawmakers expect us to keep coming up with the revenue to provide these services? We're mandated to do it. We're happy to do it. We need to do it, but we can't do it anymore. EMS doesn't have the luxury of choosing whether or not we go on a call. Unlike doctors and other medical providers, we cannot refuse MA patients. We do not say to a patient that is on medical assistance, so this patient's on MA, we're not going to intubate, we're not going to defibrillate, we're not going to medicate, simply to save money. Why? Why don't we do that? Because that would be unethical and inhumane to anybody. So therefore, why is it not unethical for the legislature to reimburse us at levels less than what we need to provide humane and ethical care to everybody? Because of poor reimbursement levels, we simply cannot cover our costs, let alone provide decent wages. These wages go to people that can save a life. It's sad to say to someone that asks if you want fries or if you want a hamburger, you want ketchup with that, can make more money than someone that can provide emergency care. And that's the truth. It's a simple truth, and it's a sad truth. What's more important, having the responsibility of caring for a life is simply not forgetting about the ketchup. While I do not mean to diminish anyone's job, I am simply stating that EMS workers have a large responsibility compared to other jobs. Recently, we've all heard about the opioid crisis and the vast amounts of funding going to that. While it's a noble effort and it must be attacked at its root issue, what if there wasn't an ambulance service there to provide for those that overdose? I think that would be a much larger crisis. Rural EMS is fast approaching a precipice. Then a decision will have to be made by providers and lawmakers. That decision will be, do we continue to provide life-sustaining EMS, or do we go back 40 or 50 years and not provide any interventional care, much like when funeral homes provided transportation of non-ambulatory patients? The answer for a modern and humane society is simple, that we must do all we can for our sick and injured. How many of us have heard, how many of all you heard a crying loved one saying, please do something? I think raise your hands. How many of you have been in that situation? A lot of you. A lot of you. I humbly ask our lawmakers, please don't put us into a situation where we have to cut services for what we provide and have to look at a loved one in the face and say, we're sorry, but unfortunately, we can't any longer. I know that everyone in the legislature is faced with so many more people asking for funding, more and more, everybody. But I must remind you that the care of the sick and injured is one of the most basic needs of a modern society. And I just have to note that Dean started by saying that we need an access problem before it needs. How stupid of a remark. That's just idiocy. We have to wait for people not to be picked up, whatever, treated before there's a problem. Is that modern thinking? No. Anyways, I want to thank Representative Causer again, and I appreciate everybody's support. Thank you.
Thank you, Bert. Thank you for the life-saving service that you provide in north central and northwestern Pennsylvania. Folks, our EMS personnel are lifesavers. Every single day, they're out there saving lives, and they're struggling. And I can tell you, in rural Pennsylvania, depending on the resources that are available, there are times you could have a serious medical emergency and not get an ambulance within a half an hour. Not within a half an hour, or maybe longer. And I don't think the general public realizes the crisis situation that we're in. And it's time that we stepped up to the plate. It's time that we send a message all through this building that these ambulance companies deserve our support. You heard what Bert said. You know, these are lifesavers, but in some cases they're actually being compensated less than people who work in fast food restaurants. And that's no criticism of people who work in fast food restaurants, but these folks are saving lives. I've had the opportunity to work as an EMT, as a police officer, and even as a 911 dispatcher before coming to the legislature. I've been on the end of those calls where people are calling for help and an ambulance is not arriving, so they call back a second time and they say, "When is it coming?" And you say, "I'm sorry, I'm working as hard as I can to get someone there." And then they call back a third time and they say, "Where's the ambulance? It's been 20 minutes. When are they coming?" "I'm sorry, I'm trying as hard as I can to find an ambulance to come and help you." And the situation is getting worse. It's getting worse. It's not getting better. So it's time for us to come together. This is not a partisan issue. It's time for us to come together and support these EMS professionals that provide this life-saving service. So I want to thank everyone who is here today. Thank all of the EMS professionals. Thank all of the legislators. We have a very strong coalition supporting our ambulance services. And let's meet with legislators and others throughout this building and send a message to support our EMS services. Thank you all for coming.